As we look toward moving into phase 3, it's critical to acknowledge and work to change the disproportionate impact of the pandemic on Black and brown communities. As you saw last week, we have a strong plan in place to do just that. Statewide, our data continue to look good. VDH continues to hire contact tracers. As of yesterday, there were about 1,000 contact tracers on board, including existing staff and new hires. As you can see on this slide, we're seeing a decline in people hospitalized with a positive or pending COVID test. That has been trending downward for a couple of weeks. And just to kind of highlight that slide, the light blue on the bottom are COVID-19 patients who are on ventilators, and as you can see, that's trending downward. A little bit darker blue in the middle there are COVID-19 patients that are currently in the ICU, and again, that is trending downward. And then the dark blue just under the yellow line is the total hospitalized COVID-19 patients. So all of those continue to trend downward. And on this slide, you can see that our hospitals continue to have bed capacity. And I think that slide is fairly self-explanatory. As of June the 2nd, we have averaged between 8,000 and 12,000 tests per day. And on this slide, you can see that our percentage of positive tests has been trending downward and is now at 6.4%. And I want to remind all of you, this is because Virginians, you, have followed the guidelines of social distancing, hand washing, and use of facial protection, and we encourage you to continue doing that. We have enough PPE for our hospitals, and we continue to work with other health settings to ensure that they have the PPE that they need. Since last Friday, we have distributed a total of 38 shipments of PPE, primarily to local jurisdictions, assisted living facilities, and higher education. The Reform Alliance has donated 170,000 disposable 3-ply masks to Virginia, and we're distributing that to jails and correctional facilities. So thank you from the Commonwealth of Virginia to the Reform Alliance. We also have more than a dozen different PPE contracts so that our supply chain remains diversified. To date, we have distributed nearly 860,000 N95 masks around the state, more than 1.6 million surgical masks, and around 4.4 million gloves. With all of this data, we are comfortable planning to move into phase 3 next week on Wednesday, July the 1st. This gives us about 3.5 weeks in phase 2 where we have been able to follow the data. It continues to continue to be surges in other states, and we are monitoring that very closely. We outlined what phase 3 will look like last week. It still means you're safer at home, especially if you're vulnerable. It means we're still strongly encouraging teleworking. People still need to focus on physical distancing in all situations outside of their home. Face coverings are still the right thing to do in indoor public spaces. But phase 3 will also bring some changes. Social gatherings may include up to 250 people. The cap on capacity for non-essential retail will be lifted. So will the cap on capacity for restaurants and beverage services, but physical distancing is still required. Entertainment venues like museums, zoos, and other outdoor venues may open at 50% capacity with a cap of 1,000 people. Gyms and fitness centers may be open up to 75% of capacity. Personal grooming services such as hair salons will still need to follow physical distancing requirements. Child care facilities may be open. Overnight summer camps will still be closed. Recreational sports will still require physical distancing, and swimming pools may be open at 75% of capacity with physical distancing. I want to reiterate that everyone should continue to take this pandemic very seriously. Cases are on the rise in many other states, as I said previously. I do not want to see that happen in our Commonwealth. Be cautious and take the necessary steps to protect yourself and the people around you. That means face coverings, which are increasingly supported by the science. It means physical distancing and frequent hand washing.